is wealth. Let's make sure we eat balanced diet, we eat healthy, you take enough water. If possible, you take like a liter of water every day, and also exercise regularly. We know how important our health is to us. So you are welcome to another edition of Health Corner from esteemed Radio Vision, Obokun Avenue, Ilesha, Osun State. And a special thanks goes to the executive producer in person of Dickie Michael Adeboye Ashaolu, and to every esteemed members. We say thank you, and the man behind the console, Big Balo. My name is Olaamy Arubola, and with me here is.
All right, thank you, Olaamy. My name is Adenipekun Afolabi, welcoming you to your favorite program, Health Corner, on esteemed Radio Vision. Today, we are going to give it to you. Okay, let's sit back, sit tight, and let's listen to today's topic. Thank you so much.
And as we all know, this program is designed to enlighten you and to also give you tips about your healthy choices that you make daily. So today we'll be talking about the topic which is labor. We all know what women go through when they're about to like give birth, their labor, when they are expecting their babies. So that's why we have a professional nurse in our midst that will enlighten us and also let us know more about labor. So you are welcome in our midst, ma.
Thank you so much. Thank you. I'm glad to be with you.
All right.
Thank you. My pleasure.
Before nurse Nwoko, Ezinne, may constant we give us the details about the labor. You know, I want to say this. You know, there are some people that are somebody like me. I witnessed when my wife, let me put it that way, is in the hospital laboring for her to give birth to our handsome boy. Then, you know, since then I'm afraid of witness another one because of what I experienced then. And we have some people like me who are also afraid of experiencing such a situation. And you, as the health practitioner, I mean the nurse, we want you to give us for us to understand what labor means for people like me.
All right. Thank you so much, Mr. Labor is nothing but a physiological process by which the pregnant uterus, when I mean the uterus, I'm talking about the womb. Uterus is a terminology in medicine. Else the fetus is the baby membranes. After fetal maturity, that is after the regular uterine contractions that leads to progressive cervical dilatation. Cervix is the mouth of the uterus, mouth of the womb, and effacement. Effacement means thinning out, kind of getting lighter. Then followed by descent and delivery of the baby. This is what labor is all about. So labor is just all the things that goes on while a pregnant woman is about to give birth, when the baby is already mature. And what it entails is the baby coming out, placenta coming out, as well as membrane, after the baby has matured inside the womb. So, and it involves regular uterine contraction. Contraction is like a painful stimulus, a painful contraction, kind of gripping pain that will lead to cervical dilatation, that will open up the mouth of the womb and let the baby to be delivered out of the womb. Thank you.
All right, thank you for that, ma. Ma, we often hear women say they are in labor, but there are times when it turns out to not be the real labor. Are there different types of labor? Can you like enlighten us on that, ma?
Yes, there are two types of labor. Okay. We have the true labor, we have the false labor. The true labor is irregular painful contractions with cervical dilatation and effacement. It is not relieved by rest or hydration. While the false labor is also known as Braxton Hicks contraction. It is irregular and less painful. It doesn't have any effect on the cervix. It may stop when someone, the pregnant woman rests or gets water to drink, gets rehydrated. So we have true labor and false labor. False labor can occur during the course of the pregnancy as a means of preparing the woman of what to experience when the labor proper starts. So, but the true labor comes as a regular painful contraction with cervical dilatation and effacement, not relieved by rest or hydration. While false labor is irregular, less painful, with no cervical changes, and may stop with rest or hydration. We also have we also have other types of labor, but these are the particular ones that are particular to a pregnant woman, a pregnant woman that is due for delivery. We also have what we call spontaneous labor. We also have what we call induced labor. We also have augmented labor. So when you talk about spontaneous labor, is when a labor starts naturally without intervention. Then you talk about induced labor. This one is when it is artificially induced with medications. That's you help the video. It has started already by its own, but it's not enough. So you have to augment it. You have to induce it because it has not started. Sorry, for induced labor, you have to initiate it with artificial medications. The labor doesn't want to come, and the baby is mature. So you are like, what do we do now? So the doctor or the midwife will now start something. We usually use what we call oxytocin to start it. So that one is called induced labor. In that case, the pregnancy is mature, but there's no sign of labor. So to avoid the baby being post-term, being post-mature baby, you start what we call induced labor. Then augmented labor, in this scenario, the stimulation has started, the labor has started, but the contraction is not enough to be able to progress into delivery of the baby. So in that case, you also augment it. You add up a little bit of that oxytocin, but this time around, it's not as a quantity as you use for induction. So you use it to start it and let the contraction becomes more strong enough to be able to expel the baby. So in a nutshell, we have up to like 5 types of labor. We have the true labor, we have the false labor, we have spontaneous labor, we have induced labor, we also have augmented labor. Thank you.
All right. Thank you, Nurse Nwoko. With that, I want us to look at the induced labor that you talked about. And sometimes I read about inducing, that if inducing is not properly handled, it may cause issue on the mother, even on the child. Is this what I read? I want to confirm it. Is it a true things, or maybe the author just put it there? You as a health practitioner, we want you to give us the clarification on this.
Well, like I said before, for induced labor, it can only occur, you can only start it when you find out that the baby pregnancy is up to term, when you mean term is mature, from 40 weeks upwards, and the baby, there's no sign of contraction, there's no sign of labor. Yes, it is possible that you can start the induction and it will fail. There's what we call failed induction. It is also possible that you can start the induction and it will affect the baby's fetal heart. It can lead to the baby's fetal heart being low because the contraction is too much. Maybe you are using too much of the medication, oxytocin, you're using too much of the oxytocin. Or maybe you are using too low of the oxytocin, it is not enough to contract the uterus. So it works either way. If you're using too much of the medication, it could lead to a problem to the baby's fetal heart, because the contraction will be coming so frequently that it will not allow the uterus to rest. It can even rupture the uterus if you don't do it very well. So it has effect both on the mother and the child. So, but if you use underdose, you may not be able to bring enough contraction that will cause the labor you are looking for to happen. So either way, too much, too little has a negative effect. So, but when you use the proper dose, proper augmentation, depending on the body mechanism of the mother and the description of the medical practitioner, you find out that it comes out perfect. Thank you.
Okay, with this, can we now refer the CS as induction?
No, CS is not an induced labor. CS is medically okay when you after so most times after inducing the labor and it didn't occur, the next option will become cesarean section. Cesarean section is a surgical removal of the baby to the abdomen. But induced labor, when you are doing induction of labor, you're only trying to make contraction. Simple way to put induced labor is to mechanically induce that contraction so that the baby can come out from the birth canal, from the vagina of the woman. So you are not, it's not CS. Induction is not CS. Induction is just putting oxytocin inside a drip. You put it inside a drip. You can remember sometimes some women say it is hot drip. Once they put it, the woman will start contracting and the contraction will lead to delivery of the baby. So induction of labor is not the same thing as cesarean section. Cesarean section means surgical removal of a baby through the abdomen. This one you have to use the surgeon have to come around, cut the woman's womb from the skin in layers, bring out the baby. Yes, that one is cesarean section, and suture it back. Then for induced labor, there has to be a drip and a medication that will be dropping at a regular rate, at a titrated rate. And what it will do is to go and cause the uterus to start contracting, and the woman will deliver through vagina. The only difference is that normally labor comes naturally, but this time around we are trying to induce the labor by ourselves, just like the word induction. Induction means starting, commencing something, starting something, making something to happen. So we are trying to make the labor to happen mechanically, artificially, without it being naturally commenced. Thank you.
Okay. With your response now, so how does a woman know when she's truly in labor?
Well, there are signs of labor. There are signs. When any woman that comes antenatal, they will be taught all these signs so that they will know when to pack their bags and start coming. Because pregnancy, even if you have a date of coming, you're supposed to deliver, most times it happens 2 weeks before or 2 weeks after. So you don't know the exact date your labor will start. So we teach them early the signs of labor and we teach them early signs of labor, definite signs of labor, so that they will know what to do and start coming. They will know what, if they see it, they will start coming. So early signs of labor includes lightening. What we mean by lightening is that the baby descends into the pelvis. You find out the mother's abdomen, before it might be getting to the chest, might be getting towards the chest, but all of a sudden it will look as if it came down, it dropped. So that by that lightening, the baby's head, the baby descends into the pelvis, into the pelvic region, from the abdominal region into the pelvic region. That one is called lightening. Then there is increased vaginal discharge. There is also which is energy burst, nesting instinct, which is energy burst. Those are the early signs the woman will see and know that labor is about to start. Then there are another definite sign. 3 or 4 other definite signs of labor include regular painful contractions. When a woman notices that the contractions are coming regularly, they are painful and strong, she should know that labor is about to set in. Another definite sign is a show. We call it show. This show is known as a passage of blood-stained mucus plug. It will look like a catarrh, but it's blood-stained. We call it show. That is what goes to cover the mouth of the uterus so that the infection cannot pass through. Nature is so wonderful. It made it because the mouth of the womb is open. So that thing that looks like a mucus, that looks like a catarrh, will go and cover the mouth of the cervix. But once labor starts, that show will come out, and the woman will see that thing as a catarrh in her body, in her vagina, and notice and know that definitely labor is already on its way. She's about to deliver her baby. Then another definite sign is rupture of membrane. Rupture of membrane, we can call it breaking of water. It could look as if the woman just urinated on her body. To look as if the water just poured. Wow! It is not like, it doesn't come like urine, but it's just like, it comes like something that breaks and pour. Wow! Like, just like that. So then the 4th definite sign is the midwife or the doctor or the nurse in charge that will notice it. Progressive cervical dilatation. So when we do what we call vaginal examination, we'll notice that the cervix has been dilated or is progressing from one finger is 2 cm to 2 finger 4 cm, depending. So at the latent phase is between 0 to 3 to 4 cm, then upwards we call it the active phase. So these definite signs are the signs that the woman will see and know that she is in true labor. Which the first one is regular painful contraction, the second one is show, the third one is rupture of membrane. Then the midwife or the person that is conducting the labor notices the cervical dilatation, because the woman cannot put her hand inside her cervix to know whether there is a cervical dilatation. But that progressive cervical dilatation confirms that the labor has actually started. Thank you.
Thank you so much for that. Guys, are you listening what we women go through? We do a lot, carrying your baby, giving birth and doing putting them on the right track as well where they grow up. We do a lot of work aside you guys putting in money. Just we are the ones that do all the job most times. So treat us like a queen.
I agree with you.
Yes. So talking about stages, how many types of stages do we have in labor?
We have the active phase. We have active phase. We have the latent phase. That's stage 1. We have the active phase. We have the latent phase. We have the stage 2, which is, so let me just take it from stage 1 and stage 2. If the phase 1 is made up of latent phase and active phase, that's phases of the labor. The latent phase and the active phase. Then the stage 2 is also known as, is also a different stage of its own. So let's talk about.
Sorry, Nwoko, we have one caller here. Hello.
Okay.
Hello. Hello. Good evening. Your name and where you are calling from?
All right, I'm Chama calling from Anambra.
All right.
All right, so I have a question for the nurse, quick one.
Okay.
All right, so please can you throw more light on a lady having a retrovertical womb? Can she actually have babies like
Please come again. Please come again.
a lady having a retrovertical womb? Can she actually have babies like a normal people? Yeah, if I may say.
Say that again. A lady having what?
A retrovertical womb or uterus, sorry.
Retrovertical bone.
Yeah, a retrovertical uterus.
Okay, retroversion, uterine retroversion. Okay.
Yeah.
Thank you so much. Well, can I answer your question now?
Go ahead.
Okay. Well, uterine retroversion. With the uterine retroversion, it means the uterine is turned, instead of anteversion, it's called retroversion. It goes backwards. So most times before pregnancy, it can actually come back to its anteversion phase, but it doesn't stop the labor from happening. The only thing that can make the woman not to deliver her baby is if there is a breach, there is a phase presentation, a presentation that is so difficult that they cannot deliver it vaginally. But if the uterus is retroverted, is also is a complication in labor, but most times it corrects during the stage of pregnancy, and comes back to anteversion. So that retroversion of the uterus just simply means that the uterus, instead of facing forward, it is facing backwards. So the only thing that can stop labor from happening in that case is if the woman has what we call shoulder dystocia, obstructed labor, and all the rest of them. So that is the only thing that makes the woman not to deliver vaginally. But if she carries the pregnancy to term and the cervix dilates up to 10 cm normally, the woman can deliver her baby safely. But if with all that retroversion, there is obstruction of labor, That's either maybe maternal pelvis is smaller than the fetal head to pass. Then that is why the woman cannot deliver her baby vaginally. She has to deliver through cesarean section. I don't know if you have answered my question. Retroversion and
All right, ma.
perversion
Yes,
means
ma. Thank you very much.
yes.
Okay, all right. Thank you, Amaka, from calling. Really appreciate your call.
Thank you.
Back to the question,
The stages.
the stages of the labor now.
Okay, with stages, we are talking about the stages of labor. We have labor is divided into 3 main stages. Some people will talk about, some authors will talk about the first stage, which may also be included, but basically we have 3 main stages. The first stage is known as the stage from when the labor has started fully to the time when the cervix dilates up to 10 cm. That is the first stage. So, and the duration for a first-time pregnancy, we call them primigravidas. The people that conceive for the first time, they call them primigravidas. The people that have conceived up to 1, 2, 3, or 4 times and above, we call them multiparas. So the more pregnancy you have, the less hour you have your stage 1 it becomes. But the less pregnancy you have, the more the time for the first stage 1 to take place. So for a primigravida, it takes about 8 to 12 hours for her to dilate completely up to 10 cm. Then for a multipara, it takes her 6 to 8 hours to dilate completely. Then this stage 1 has what we call the active phase and the latent phase. So the latent phase of the stage 1 is known as when the cervical dilatation is between 0 to 3 to 4 cm dilatation. During this period, the contraction is irregular and it is mild, and the cervical dilatation is slow. So you have up to maximum of 0 to 3 or 4 cm dilatation in this latent phase. But the active phase, which is the second phase of the first stage, remember I said the first stage is divided into 2, active and latent and active phase. So the active phase, during this period, the cervix dilates from 4 cm to 10 cm dilatation, and the contractions here are strong and regular. There's a rapid cervical dilatation. Then there's increased maternal discomfort. Because of the contraction, the woman will not feel comfortable. That's why they also always cry during labor, because the pain is actually painful. Then you have to talk about the stage 2. Stage 2 is from the full dilatation of labor to full dilatation to delivery of the baby. From full dilatation of the cervix to delivery of the baby. Then it can take up to the duration for a primary gravidity. It can take up to 2 hours for this to happen. Then for a multi-primary para, it can take up to 30 minutes to 1 hour for this to happen. Then what actually happens there is that the baby descends, the mother bears down, pushes down, then the baby is delivered. So that is it. So, and it takes place in what we call the mechanism of labor. We talk about the engagement. Engagement means the fitting of the head into the pelvis. Then you talk about the descent. Descent means just like the name, descending. Then you talk about the flexion. Flexion means the bending of the head so that it can actually maneuver through the pelvic bones. Then you talk about the internal rotation. Internal rotation means the head turning clockwise or anti-clockwise to become what we call right occipital anterior or left occipital anterior, depending on which side the baby is presenting with. Then you talk about the extension of the head, which is a little bit tilting of upwards of the head when the baby is coming out. Then another one is restitution, which is also a form of turning as well. Then you talk about external rotation. This one happens when the baby's head has already come out from the vagina. Then you now talk about expulsion. Here, the delivers, the shoulder, and the body. That is what happens. These things I just mentioned here now are the things, the mechanism of maybe the mechanism of the movement that takes place. Because we say the second stage means the stage from when the cervix is fully dilated from 10 cm to expulsion of the baby to full delivery of the baby. Then the third stage is the delivery of the placenta. The delivery of the placenta, it takes about 5 to 30 minutes for the placenta to be delivered. And it has a process. The separation of the placenta is the first stage. which can happen as a result in the form of what we call the names of the people that first discovered this process of separation. The first man is called the shoes, or the Matthew Duncan's mechanism. Then expulsion of placenta and membranes. Then you have signs of placenta separation. You have what we call lengthening of the cord. Find out that before the placenta, before you know that, before the midwife starts to pull out the placenta, there are certain she will have to look out for before she starts doing that. That is the signs of placenta separation, which is lengthening of the cord.
What are the signs?
Yeah, the first one is lengthening of the cord. The cord becomes longer. The umbilical cord that came out becomes longer. You find out that the length is longer. Then there will be a gushing of blood. A gushing of blood. Then the fundus rises and becomes firm. The fundus is the top of the upper part of the uterus. You find out, when you look at the woman's abdomen, it looks as if it has risen up a little bit and has become a little bit firm. So how you manage it is you do what we call controlled contraction, and you also give uterotonic agents. There are some medication you give. You can give oxytocin. You can also give egometrine. Then inspection of the placenta for completeness. When you deliver the placenta, you make sure it is complete because it comes in lobes. So you have to check for all the lobes that they are complete. So that because if there's anyone retained inside, it will make the woman to bleed so much. So you have to make sure it is complete. Then the first stage of labor is called, according to, because I told you we have 3 stages. I mentioned the 3 stages, but some authors will say there is a 4th stage, which is what I'm about to tell us now. They said it is also known as the recovery stage or the first hour postpartum. Here, the mother is monitored for postpartum hemorrhage. We are going to look at this postpartum hemorrhage sometime in the lecture, sometime during the week. So, we are trying to prevent it. So the woman will be monitored. Then they should be given ensure uterine contraction. You can massage the uterus so that it can contract again and become firm. Then you also assess the vital signs. Then you also initiate breastfeeding, because one of the importance of breastfeeding is that it helps the uterus to go back to its normal position. It helps it to contract. By contracting, it will stop the bleeding that could occur if it is not well contracted. So those are the stages of labor. I've mentioned the 4 stages of labor. I told us the first stage is made up of active and latent phase. The second stage is from full dilatation of the cervix to delivery of the baby. Then the third stage is delivery of the placenta. Then the 4th stage is the recovery of the woman from the labor, or the first hour postpartum, which is also known as the recovery stage. Thank you.
Okay, thank you for that beautiful response. Now, I want us to look at the 3rd stage that you mentioned. That is stage 3, delivery of the placenta. Now, this placenta has caused many mother or pregnant women to lost their life, and maybe because as a result of delay. Now, if there is a delay, if a woman experiences delay, what is the next thing for what is the next thing that the nurse or the person that's in charge taking care of the woman, what is the first thing that he needs to do when the placenta refuses to be delivered between 5 to 30 minutes that you mentioned?
Well, that's what we call the placenta is meant to come out between 5 to 30 minutes of birth, of delivery. So if it doesn't happen, some people will say they will give it a little more time, 10 to 20 minutes more. If it doesn't happen, there's what we call manual removal of the placenta. It can be manually removed. But in that case, you make sure it comes out completely. Alternatively, if it doesn't show any sign of separation, so you to manually remove it, the next option is to remove it through cesarean section. That is just the last resort. Because if after delivering the woman and the placenta doesn't come out, you have not done anything, because that alone can cause bleeding. So it has to really be they have to do something to bring it out. So if manual separation doesn't work, the woman has to go in for cesarean section to remove the placenta.
Okay, what you are saying now is that after delivering the baby and the placenta refused to come out, the next thing is they will go for the CS.
Manual remover. You have to inside your hand. If you see a little bit of separation, then you can use your hand to slice it inside the womb. Because when the woman is delivering, with your gloved hand, you can actually insert your hand inside it.
And hope it is not
dangerous. And you can access the placenta.
It is not dangerous to the health of that woman. Or hope it won't affect the
No, you are using a sterile gloved hand. You are using a sterile gloved hand, so it's not dangerous. Because you're also going to use that hand. Some people, if you have blood clots inside, you can still use that hand to remove it.
Okay. With this now, you know, labor pains is often a major concern for women. And what are the options do women have?
All right. For pain management in labor, you have a non-pharmacological method and a pharmacological method. Okay. So for the non-pharmacological method, there are things we teach these women when they come for antenatal, because there's some people that can bear pain. There are people that cannot bear pain. There is no, I used to tell them there is no Olympic medal given to anybody that can bear the pain. If you can't bear the pain, you better voice out so that we can help you. For the non-pharmacological methods, we'll talk about breathing exercises. In this breathing exercises, you teach the woman how to take deep breaths with this contraction to remove psychologically the woman's mind from the pain, and the woman feels a lot better. It kind of helps relieve the pain. Then another one is massage. You find out sometimes when the woman is in labor, if you massage the waist or massage it very well, they'll feel a little bit better. It will no longer feel as painful as it was. Then another one is warm baths. The woman can go and shower herself with warm baths, and the pain will kind of a little bit subside. Then changing of position. If she's lying on her right side, normally we tell them to lie on their left side so that there will be enough blood supply to the baby. She can, from time to time, change to the right side and, kind of change position for a while, then come back to the left side again. That changing of position can kind of relieve the pain a bit. Then continuous support. The husband being present can give a psychological relief of the pain. Sometimes the woman, when their husband is around, they try to maintain themselves, they try to kind of comport themselves. Though some people will not. Some people will start shouting and saying, you did this to me, you did that to me. But it also helps psychologically to relieve the
Okay, you mean
then pharmacological method of managing the pain.
What you mean is that for the husband to be available, it also helps. It will be of help to the woman during labor. Is that not what you are saying?
Yes.
Okay.
Yes. To give her a psychological relief that someone is actually here supporting her through the process. So it will make her to kind of comport herself a bit and continue with the process.
I think men outside there watching us right now, make sure you are available the day your wife wants to go into delivery, so that you'll be of help to her. She won't see you as someone who doesn't care for her, but your presence will be of help. Don't be a kind of father that there's some father in Yoruba land, when your wife delivered before your absence, they named the baby Abidemi. That means that, okay, you delivered before my arrival. Don't do that. Make sure your wife delivered when you are available, right in your presence. And on this, I want to ask, this one has to do with the man. During the pregnancy, most of the women, or let me say most of the men, flee away from their responsibility. You understand what I mean? Flee away. What I mean with their responsibility is that by giving their woman back to back what is expected of them, they will say, oh, you are pregnant, I cannot have any intercourse with you. And would having sexual intercourse with your wife during the pregnancy be of help for, I mean, why she want to deliver?
Yes. Well, pregnancy is not an excuse for you not to give your husband sex, except if your pregnancy is a high risk pregnancy. You're having some challenges, you're having miscarriages, your service is not adequately okay for you to kind of carry the pregnancy. That is the only condition where you cannot give. But if everything is
We are with you.
normal, it's even good for your husband's sex because because it helps you to have a roomy vagina, so that when the baby is coming out, it will not be so tight, and they will not give you cut. Because if it is so tight, we'll use the scissors to cut it so that the baby can come out. Later we'll suture it back. So, but if you have a roomy vagina and we don't have any need to give you a cut, so sex during pregnancy is very advisable. Both to make sure your bond with your husband is there, so he doesn't go outside there and get infection and come and infect you, or kind of stop giving you your chop money. Because if you don't give some men,
Yes.
when you don't give them sex, that means your chop money for that day don't go. So
they will go and give
we
it
don't
to
want such a thing to happen.
another side chick.
Yes, we don't want that to happen. So our pregnant mothers, we're advising you, sex during pregnancy is not contraindicated. It helps. It helps you. It is for your own good, except for the conditions I mentioned when you are having continuous miscarriages, and that happens during early pregnancies. During late pregnancy, it will help you to have a roomy vagina, so that we cannot give you cut during the delivery. So sex during pregnancy, especially last trimester of pregnancy.
Okay.
Doesn't have any.
Okay, someone I received one message now on my phone right now that okay, peradventure the husband is not available. What should the woman do for her to have a lubricative vagina, like you said?
If the husband is not available, there's nothing she can do. I wouldn't advise her to. Some people will say maybe she can use it. Might injure herself. I would advise that. Give a call. We'll still suture it. If the vagina is not roomy enough, we'll still suture it, because the only thing the is to make sure it's roomy. So, but if the husband is not around, I've not advised you to go and be sleeping with another man. That is not advisable. So you see that you only bear the pain. That is what you do for love, for the sake of your marriage. Because if your husband finds out you are sleeping outside, it's another problem. So if you cannot, if work makes it, if your relationship with him, I mean the condition which both of you are living makes it impossible for him to be available, there's nothing you can do. You can also deliver your baby. There's also what we call pelvic exercises. You can be doing some pelvic exercises to strengthen the muscle of your pelvis, like tightening and loosening yourself, like doing as if you want to urinate and holding it, something like that is another topic for another day. So that pelvic exercise the muscles of your pelvis so that it will be roomy enough to deliver the baby. So sex during pregnancy is good, especially third trimester. But if you cannot have sex because your husband is not around, don't bother yourself. It's not a do or die affair. The cut is not painful. It's not too painful. It comes with you won't even know when we'll give it to you. At the height of that contraction, that is when we'll give it to you. And when we want to suture it, we'll give you an local anesthesia before suturing it, so you won't feel much pain. And the good thing nowadays is that the suture, you don't need to come back to remove it. The suture is absorbable. Once you suture it, you don't need to come and remove it again. It will just absorb into your skin and you don't feel much pain for removal of it. Thank you.
Okay, what we are now saying is that getting lubrication cannot be in the place of normal sex with one's husband.
No. Getting lubrication, as in getting lubrication from what? From what? Is it from toys?
No, there are some people that says that okay, they do sell lubrication at the pharmacies that they can use in replace of their husband duty. I want to confirm that.
Lubrication or toy? Lubrication or toy? Lubrication is different from toy. Lubrication means to just make it to be kind of slippery so that anything can enter smoothly. But toy, what toy does is to enter. It does the same job as the penis does. So I don't know which one you're talking about.
Are you referring to dildo or something?
Yes, I'm talking.
Dido, yes, Dido.
Okay. What you are saying now?
Are you talking about Dido?
All those things are not advisable. I'm just asking so that for women outside there, we know that the best thing for you to do is to just make sure you create time to have a nice time with your husband during your pregnancy period.
Yes.
Don't say because the distance should not be barrier. Make sure you create time to be with your man and the men that outside there. Don't feel away with your responsibility. It's your responsibility. Make sure you do it regularly and to be of help so that you will assist your wife not to have the cut, because most women do afraid that cut. And you know, there's some people that they have BP. When they know that they want to cut, definitely it may affect them. I mean, they are breathing, and which is not advisable at that period. Now, Nurse Nwoko, finally, before I will allow my co-host to ask further question, I want to ask this question. You talk about that having regular sex for a pregnant woman who is already heavy. What is the how should I put it, that the position that is advisable for that woman to be?
All right. There are so many positions the woman can assume. Well, there's one we call the side lying, maybe side, and the husband lie at their back. Then from their back, she can now have the sex. Then she can also do doggy. She can kneel on four and do doggy. She herself can also ride on her husband. We call it the cowgirl. You know, so these other options, these are the few options she can use. She can use it. They can even do, that's what they call scissors position. They can do scissors position.
Okay, I have one.
So we have position, the side lying. Yes, I hear you.
Okay, I have someone here. Okay, Modesta Chiamaka, she's asking a question on the comment section. In the comment section, that won't the penis be eating the baby's head, and won't it be painful?
What a thoughtful question.
Thank you so much. No, it will not hit the baby's head. Once I told you that the penis, no matter how long it is, it can only get to the cervix. It cannot enter inside the womb. And already, nature made it in such a way that there's what we call that show that we talked about during labor, as a definite sign of labor, is what covers the mouth of the cervix, the mouth of the uterus, which is the cervix. So the penis cannot actually hit the baby's head. Even the baby's head, it is a muscle. It's not a bone. It's not a metal. It's a muscle. It will not do anything. The baby's head is bone. The father's penis is muscle, so it will not do anything. It's flesh. It will not do anything. So that shouldn't bother you. It will not get to that point, and it will not be painful if the woman gets enough lubrication. And the woman does it gently and with love, and does it based on this we just mentioned now. Through these positions we just mentioned now, then there is no need for any pain and any fear at all.
All right, thank you so much for that, ma. Ma, what should happen when a woman arrives at the hospital in labor?
Sorry?
I said, what should happen when a woman arrives at the hospital while she's like in labor? What are the things to be?
All right, the first thing that happens is that, one, you have to admit the woman and do your assessment. Your first assessment starts with vital signs and fetal heart rate, You check the woman's blood pressure, BP, blood pressure, pulse, respiration, and fetal heart rate, and also the temperature as well. You check the fetal heart rate to know whether it's within normal range during and after labor. Some people do what we call the tachograph, cardiotachograph. That way, you place the woman on a machine that takes the fetal heart rate over a period of time. Then you do a vaginal examination to know what stage the woman is at. Then you review the antenatal records to know if there's any contraindication, to know if anything at all that will be a hindrance to the labor. Whether the woman has a history of postpartum hemorrhage, so as you know how to monitor the labor. If she's hypertensive, if she's diabetic, you review it from her antenatal records. Then the next thing is what pathograph charting. Pathograph is just like a chart that we use to monitor the fetal heart, the cervical dilatation, the contraction. It helps to know and terminate to normal delivery of the baby, or whether it will not progress, whether it will end up as a cesarean section. It is this book known as pathograph that will tell us that. It also helps us to detect obstructed labor early. When you find out you do a vaginal examination, the woman is not dilating, but she's contracting. You find out that there's a possibility of obstructed labor. Then, after that charting of the pathograph, we talk about, alongside the charting of the pathograph, we talk about hydration and nutrition. The woman is not supposed to eat anything by mouth, but you have to put infusions on her. Then you support her emotionally, tell her it's going to be well, whether it's going to end up as CS or whether it's not going to end up as CS. You support her, encourage her to continue and carry on so that she will be psychologically fit to deliver. Then you monitor the fetal well-being from time to time. That we practice clean and safe delivery practices. Make sure each time you want to do a vaginal examination, you're wearing a sterile glove. You make sure the environment you're keeping her is clean. Make sure everything you're doing for her is safe for her to deliver her baby safe and sound. So all these things I just mentioned are the way she comes into the hospital. Once you have established that she's in labor.
All right. Thank you, ma.
Ma, what of those women that dies during labor? Is it due to complications, or is it mostly because of complication, or there are some that is just natural? It's not just meant to be.
Well, you find out that some people, that is why I mentioned this book known as pathograph. Some people might be contracting for so long. Maybe they started contracting in the house. They didn't want to come to the house. They want so that when they come in, they don't know that we need to know how long you have been contracting, because there's there's a way you be contracting. It might even rupture your uterus, so that before we can even die, because the woman will bleed so much. And you know the uterus is very vascularized. When I mean vascularized, is that it has something that makes it to bleed so that the person will die in minutes, because the blood loss through the womb is much. So things like that, staying in the house without coming at the appropriate time, and also wrong practices. When you know that the pathograph is telling you that this woman is not progressing, instead of you to go ahead and book this woman for surgery, you want to let her to continue to labor. The woman might die because it might be obstructed labor. The woman might, out of exhaustion, she might get exhausted and collapse and die. And even the baby might not make it because the contraction will be so much, there's no headway, and the baby will be suffocating inside there. So that is what the options that can make the woman die during labor. The problem could be from the woman that is in labor. The problem could be the health practitioner who doesn't know her onions, who know when to say, no, you cannot continue like this, go for cesarean section. So it is either way, either a fault of the woman or the fault of the healthcare practitioner who doesn't know her onions. Thank you.
All right, thank you so much for that, ma. Ma, for those that have undergone CS before, is it true that they have to, like, when next they want to have their baby, they have to go through CS again, or how is it going to be?
Or can they deliver naturally without going for CS again?
Well, it all depends. If a woman had the first pregnancy through cesarean section and she waited enough for at least minimum of 2 years, 1 year 6 months or 2 years before getting pregnant again, she can deliver normally if there is no contraindication for the CS. If the reason for the former CS was because the baby cannot pass through her pelvis, her pelvis is not adequate because we have different types of pelvis. If the pelvis is like that of a man, what we call anthropoid pelvis, it is not a normal gynecological pelvis, then the woman can go through CS again. All the baby she will have, it has to be through CS. But if the problem was because of a fetal condition, maybe the baby cannot sustain, was not able to condone the pressure from the contraction, then because of allowing so that the baby will not die, they now advise her to go for cesarean section, and she did cesarean section the first time. It is not an indication that she will continue to have her babies through cesarean section. She can have her normal babies subsequently if the reason for the first cesarean section was not as a result of pelvic problem, was not as a result of maternal problems, so she can deliver her subsequent babies through vagina. But if it is because of a pelvic problem, then subsequently she will have her babies through cesarean section, and she cannot exceed maximum of 4 babies. She cannot exceed maximum of 4 babies. Some people will tell you 3 self. Anything 5, she's trying to endanger her life. Thank you.
Okay, thank you. Before we round up on today's episode of Health Corner, I want to ask this: is there any factors that affecting labor? And okay, before then, if someone is experiencing a complication, maybe you have a complication like, okay, after giving birth, the blood that's supposed to stop didn't stop, the blood is still gushing out. What are the things to do, and what are the factors affecting labor?
All right. What you are trying to tell, we call it postpartum hemorrhage. When after delivery and the woman is still gushing out blood, because it depends on the quantity of the blood. After delivery, immediately after delivery, there's meant to be some little blood coming out because it's actually a wound it's just like a wound that is just healing. There'll still be small blood coming out. But when the blood is very torrential, when it is heavy, it's known as postpartum hemorrhage. We'll do what we'll rub up contraction to make the uterus contract so that the bleeding will stop. Then, if it doesn't stop, we'll hang on what we call the oxytocin to stop to make sure the contraction is adequate so that the postpartum hemorrhage will stop. So, and also if it doesn't exceed, we also give them what we call magnesium sulfate in severe cases. We give them magnesium sulfate. So that is it. So there's a way we manage postpartum hemorrhage. These are all the things I just mentioned now are the way we manage postpartum hemorrhage. And the factors affecting labor, remember it with what we call the 5 P's. The 5 P's. The first one is the passenger, which is the baby. We call it fetus. The size of the baby, the presentation of the baby, and the position of the baby. The second one is the passage. That is the pelvis and soft tissues. The pelvis is the mother's hip. If it is adequate, the woman can deliver her baby. If it's not adequate, the woman cannot deliver her baby. Then the powers, the third piece, the powers. When we talk about the powers, we are talking about uterine contractions and the maternal pushing. Ability of the mother to push out her baby and the ability of the contraction to cause the baby to come out is what we know as the powers. If it is adequate, the woman can deliver her baby comfortably. Then the psyche is the fourth P. That's the mother's emotional state. If the mother's emotional state is stable, if it is in a stable emotional state, she can deliver her baby safely. Then another one is position, maternal posture during delivery. Depending on the hospital policy, some people, there's what we call the lithotomy position, which is the normal position for delivery. Some people might decide to squat. Some people might decide to do it in a pool, depending. But the normal position is what we call the lithotomy position. When you adopt this position, the woman is meant to deliver her baby safely and sound. Thank you.
All right. Thanks for that beautiful response. You talked about the psych A. Now, this bring me to this question. You know that some women, after delivering their baby, emotionally or mentally they are not stable. What do you think that it is the causes of this?
Well, labor itself is a traumatic experience. Pregnancy and labor is a traumatic. There's some people that after delivery, they actually have what we call postpartum blues. It's a psychiatric problem. It's as a result of the trauma of labor. It happens. So it's part of it. So that is why after delivery, the woman is meant to stay in the hospital to monitor her both physically and emotionally. And if there's anything going on emotionally, the hospital has to take care of it with the medications and so also counseling so that the woman will be back to her normal state again. So the psyche is very important, both during the labor and after labor, so that the woman will not come down with what we call those pattern blues or psychiatric problem after delivery. Thank you.
All right. Thank you. This has been a very enlightening,
Yes.
and I believe that even me as a man, I've learned a lot. Despite, with this, I believe that women listening to us, watching us right now, will have also learned one or two things about labor. And without this labor, there is no how one can have your child, either a baby girl or a boy, either of the two. And on this note, before we wrap up on today's program, what is your final advice for for pregnant women and their families?
Well, my advice is to pregnant women and their families is this. Once you are in labor, don't wait. Once you see those cardinal signs we mentioned, they show the rupture of membranes and the contraction, the painful regular contraction. Quickly go to any nearby hospital where you register, because I'm advising you before you even talk about labor, make sure there's a place you are going for antenatal. It's very important. All these things you are seeing here, they are all topics, major topics you teach as a separate topic each day on the antenatal class. So when you go for antenatal class during labor, it will not be difficult for you because you will be taught even how to push. You need to know how to push. You need to know what to do. You need to know what to see and you start coming to the hospital. You need to know what the differentiate between normal labor and Braxton Hicks contraction. So when you are not going for antenatal, you won't know all these things. And antenatal is like a class because pregnancy is not a one-day something. It's not an emergency. It is something you do for 9 good months, 40 weeks. So you are meant to go for antenatal, know what you're supposed to know what you're supposed to do during labor so that you have a safe delivery. And know whether, if your labor is not progressing, know whether to go for cesarean section. Because any baby, whether you deliver it through your vagina or through cesarean section, is still a baby. You are still a mother. The most important thing is a healthy mother and a healthy baby. You don't go to a place where they tell you must deliver like a women of Hebrew.
Like
you must deliver. You must deliver. Yes, there's no way of delivery that is not normal. They are all normal depending on your own condition. That mother A delivered through her vagina does not mean you will also deliver through your own vagina. If you cannot deliver through your vagina, you deliver through cesarean section. It is still a baby. The most important thing is that you are alive. So if you go and say no, you are going to your maternity, especially those of you that used to go to quack traditional birth attendant, I'm advising you on this note. Stop patronizing them. They are not midwives. They don't know when there is a problem. They don't know when to tell you you should stop pushing. They don't know when to tell you to push. There's even a time you can push and your cervix will rupture and you start bleeding and bleed to death. I think one of the lady, I've forgotten your name, the lady that is with you, she asked something about women die during labor. Yes, this is one of the things that can make them die during labor. When the birth attendant is not competent enough to know when to tell the woman to push. If the cervix is not fully dilated and you tell the woman to push, the woman can rupture her cervix and she will bleed to death if there's nobody there to suture the cervix. And it's an emergency. It's a serious emergency that can lead to women to death. And so many women have died because they are pushing when they are not supposed to push. So many women have died because they are still laboring when they are supposed to go for cesarean section. So stop patronizing quacks. Stop going to traditional birth attendants who did not go to the 4 walls of the university, to the 4 walls of the schools of midwifery and nursing to know what it entails to manage a labor. Because it's not easy. You might think, yes, some people in their house, they deliver problem. Yes, those ones, they have a gynecological pelvis, everything is normal. Under normal circumstances, if they come to the hospital, it will still be normal. But for you that doesn't know your fate, have not been pregnant before, you have not delivered before, and you go to traditional birth attendant, you are risking your life. They will tell you to continue to push, you are in labor for 3 days, 4 days, you are still in labor, you are dehydrated. You are going to kill yourself. So better register in a good hospital with maternity, with a good midwife or a gynecologist that can deliver you safely. Stop patronizing quack. I'm using this media. I know Esteem Radio, you air it everywhere. I'm saying it now, and I'm saying it for the sake of all the mothers. Save your life, because if you die, your husband will go and marry another wife. The maximum he can do for you is to stay for 1 year. If I thought he will stay for 1 year for you, the next thing he does is to go and marry another wife, and they will give birth to that children that you are going to save money for. If your mother husband gives you money for antenatal, don't eat it. Use it and go for antenatal. Go for a good antenatal class and make sure you know what you're supposed to know, so that you can deliver a safe and sound baby. Pregnancy is not a child's play. It is not a joke. There are so many complications that can arise. Labor is not a child's play. There are so many complications that can arise. If you're not in the hands of a competent midwife or a gynecologist, you are risking your. Stop patronizing quacks. Stop patronizing traditional birth attendants. They are not midwives. They are not gynecologists. They cannot manage your labor. You are risking your life. Thank you. I know they said a word is enough for a wise. So if you are listening to us this night, make sure anytime you're pregnant, go to a good hospital. Go to a good maternity home. Don't go to traditional birth attendants in the home that doesn't have facility for cesarean section. Go to a well-established hospital that has a maternity section. Take care of you immediately. So within already your baby is out, so that they will save your life and that of your baby. Thank you. That's my own little advice. Thank you.
All right. Thank you so much for that beautiful advice. On this note, we are going to draw the curtain on today's episode of Earth Corner. We say thank you for giving us your time on the program. I mean, Nurse Nwoko, Ezinne, Mary Constant. Thank you so much for giving us your time.
Thank you. It's my pleasure.
All right. And to all our esteemed viewers, let me use this medium to announce to you against tomorrow, or ahead of tomorrow's program, the first 5 callers on our program tomorrow, you are going to get yourself a free medication. You are going to get yourself free medication. The location where you are, that is not a barrier. We promise you 5 first caller tomorrow on our program when it is 5 p.m. Nigerian time. Join us on the Earth Corner and let us have your comment, and you put call through the studio line 0916 634 9956 0916 634 9956, and the number is on the screen. You can just copy it down right now against tomorrow, because the first 5 callers, they are going to get themselves free medication. That is proudly sponsored by the founder Eni Aponle Foundation, Deacon Michael Adeboye Ashaolo. All right, on this note, I'm saying thank you to every one of you, and to the man behind the console, Balogun Absamar. Thank you for your time, and to our esteemed staff right from the Chiamaka Obidike and Faloye Ayomikona. We have Anoluwapo Akonde. We are saying thank you. God bless every one of you. On this note, sign out on today's program, Earth Corner. I still remain my humble self, Adenipekun Afolabi, your prince on the show.
And I'm Olaamy Aribola. Till next time, stay healthy. Bye.
Bye, everyone.
Rest that keeps you whole. Wellness isn't precious. gift to your soul. Welcome to Health Corner. We flow with the rhythm of care, where your body finds comfort and your mind gets